Xanthelasmata. It is possible that Xanthelasmata is an indication of high blood lipid levels and, if it has a high risk of ischemic heart disease, may be associated with an early death. It presents as a yellowish coating that forms on the surface of blood vessels such as the heart, lungs, liver and kidneys. The deposits vary in size and shape, are soft, hard or calcareous, although the variability is usually due to the chronicity of the plaque. The risk of developing Xanthelasmata increases with age, as does the risk of developing high blood lipid levels and high blood cholesterol levels. The risk of developing a heart attack, stroke, coronary heart disease or ischemic heart disease also increases. Patients with visible yellow spots should have their plasma and fat levels checked by their doctor at least once a month. If they are high, the doctor recommends a lifestyle change and may prescribe a lipid-lowering medication. To remove the visual cholesterol spots, use Xanthel. Just one treatment will remove this cosmetic blight. Xanthelasma around the eyes. Xanthelasma are cosmetically disturbing and difficult to hide due to the nature of the discolored plaques around the eyes. They are easily recognizable to the public, but not by name, and they are a cause for great concern. The skin disease is commonly associated with high cholesterol and high blood pressure. There is no malignant potential for these lesions. If a patient wishes to remove a lesion for cosmetic reasons, he should not leave it alone for more than a few days or weeks. Contact Xanthel registered and remove it at home. Cholesterol deposits in the eyes. Previous research has shown that Xanthelasmata in the arcus corneae are cholesterol deposits, but half of those who suffer from the disease do not test positive for high cholesterol in the blood test. They may be largely cholesterol-based or simply due to the presence of other substances such as calcium chloride or sodium chloride. In the study, conducted between 1976 and 2009, 4% of participants had cholesterol deposits in their eyes, but none had heart disease. An increased yellow spot on the eyelids is a more reliable sign of heart disease, and research suggests it can predict the risk of heart attack, stroke and heart failure in men and stroke in women. Defining Xanthelasma palpebrarum. Xanthelasma palpebrarum, XP, is a yellow coating most commonly found in the inner canthoses of the eyelids and is often associated with atherosclerosis, lipid metabolism disorders and coronary heart disease. Xanthelasma is a skin growth that can occur anywhere on the body and is called xanthoma when it reaches a certain size and becomes nodular. There are two different conditions. Xanthomas are conditions that occur in the skin of the face, neck, arms, legs, hands, feet, and other parts of the body. Xanthelasma and eyelid xanthomas have a characteristic appearance that makes it easy for doctors to identify them. The yellow features are collected in pockets on the skin and are mainly made up of cholesterol, but can also cause other health problems such as high blood pressure and diabetes. For most people, it is just unsightly and they used to go to a plastic surgeon to have it removed. Now with the availability of Xanthel, many people around the world remove their eyelid plaques from home with Xanthel, removing the heavy costs associated with plastic surgeons. Explore more at Xanthel.com.